Hello, my name is Martin Costigan, and today I'm interviewing Dr. Luc de Schepper on treating depression with homeopathy. So welcome, Dr. Luc.
Thank you, Martin.
Dr. Luc originally trained as a Western medical doctor, but then went on to become a qualified acupuncturist and homeopath. And Dr. Luc has treated over 200,000 patients in 30 years of practice in his native Belgium and in the United States. And his website is drluc.com. So Luc, just to start with, for people watching this video who have little or no knowledge of homeopathy, could you please explain what homeopathy is and how it differs from Western medicine?
Homeopathy had its origin in Germany and by the genius Hahnemann, Samuel Hahnemann, who was a physician. He was born in 1755 and died in 1843. And when he was a physician around the age 20, 21, he really, at that point, conventional medicine did not really have many weapons to treat about any disease. You know, we're talking about 1800. And so he got very discouraged, and while he was translating books, you know, medical books, in order to have some money, to earn some money, he basically fell onto the, I could call it the apple of Newton. You know, he was talking and reading about China, cinchona, which is quinine. You know, he was reading about fevers that were actually treated with China, and he decided to take some of the particularly bark of that tree himself in small doses, and lo and behold, he could actually cause the symptoms that were actually belonging to a kind of fever or a kind of malaria at that point. But that had no particularly bad effects from it. In other words, after a certain amount of time, a short amount of time, the effects went away and he was totally normal again. So this was really the beginning of the principle that, you know, we have to create a similar disease, but that's stronger than the regular disease, so that because two similar diseases, the stronger one will overpower the weaker one. And we really have seen that, you know, every doctor or even every patient can see this, that, for instance, when they have, let's say, chronic rheumatism or chronic arthritis, and now all of a sudden they get a strong flu, that the rheumatic problems disappear, and yet, and as long as the flu is present, we see indeed that the rheumatic problems are not appearing, but the moment the flu is over, I mean it's cured, then the rheumatic symptoms come back just as they were before. We see this also even, to bring it more up to par, with autistic society, where children, when they have high fevers, you know, just a childhood disease or a flu or anything, a cold with high fever, that during that time that they have this, that actually their symptoms improve quite a bit, but again, at the same time, to disappear the moment the fever is over. So you see, this is really the first principle. You create, there is a stronger disease, but not, you know, but a similar disease, and then we actually, or dissimilar disease, in this case, of course, not the same, and we actually can, you know, suspend the chronic disease, it goes away for that time being, of course. So when he thought, if I create then a similar disease, you know, that means with the same symptoms, but stronger, it probably will push away the old disease, and indeed it does. That's the like cures like, as we always call it. Which is, like I said, is to be seen anywhere in the practice by patients and physicians alike. And that was really the beginning at that point, because Hahnemann did what we call proving. So we always think, well, were those medications, those remedies, were they tested really? And of course they were. You know, he tested them first of all on himself, taking a small amount of the remedy in, and see what particular symptoms it was going to produce. And then obviously afterwards he had his colleagues, his family doing the same thing, and he basically proved or tested, you can say, about more than 100 remedies on himself and further on. So this was really the start, one of the principles, but it became, you know, again, the start of a science that has nothing but good principles really, because they are really linked to observations of nature. You know, and that doesn't lie. You know, so it really put the accent on the individuality. You know, we really can say the patient suffers from this or this disease. You know, we always want a classification in regular medicine too, and there is nothing wrong with the classification as long as we don't lose out of sight the individual in that classification. In other words, we can have the same name disease, But obviously that doesn't mean that the same trigger caused it. It doesn't mean that even all the symptoms are the same. They might be alike, they might be partially alike and partially the same, but certainly not completely. So really, as you can see, the individuality, how the individual react, what caused it, is really very much taken in account and has to be taken in account. And this is with any particular disease name, be it depression, as we are going to talk about it, be it autism, be it any name of disease that we really would mention in our conversation.
So sometimes it's said that homeopathy treats the person, but Western medicine treats the disease. So what does that mean, Dr.?
Yeah, so as our goal in Western medicine, of course, as I studied in the medical school, is to really classify, bring the diseases in particular categories, because that makes it easier for the physician to do a certain protocol. Now we have this kind of disease, this name of disease, therefore regardless really of the person that we have in front of us, except we might take into account the dose, you know, because a child's dose versus an adult dose, the weight, you know, we might take that into account too, for the metabolism of the drug that's going to be processed. But basically the main goal of putting that in categories is to really say, no, we have to really do this particular protocol for this name of disease, so that we have fixed protocols that has more to do with the disease rather than the patient that is behind that suffers from this disease. Not much of the person is taken in account, except age, height, weight, you know, but not really much more of the person, not what his profession is, not where he lives, not what his emotions are, you know, not what we call his constitution. And really, we always talk about hereditary, that we take that hereditary factors, that we take that in account too. But basically, we really don't do that, you know, in regular medicine, except of course in regular medicine, we always look, when we say, let's look at hereditary factors, it's very narrow definition, because we will look at the same name disease. If it's not present in the family history, then so to speak, there is no hereditary factors. And that's of course a rather narrow definition of hereditary background, which is very different than what we use in homeopathy.